So let's look into some of the science. There's been 18,000 research articles now, peer-reviewed research articles now on breathwork in the last 10 years, with over half of them coming out since 2010. So there is a tremendous amount of research coming out. I'll quote a couple. There's one called The Effect of Breathwork and Stress to Mental Health, which is a meta-analysis of a randomized clinical trial. It showed significant improvement in mental health when using breath correctly. Again, particularly two types of breathing, if I can be clear. Many types, but two primary types. The first thing, throughout the day, you should be a nose breather. That's why a lot of people, biohackers, athletes, will tape their mouth while sleeping because they're reconditioning their nervous system to breathe through the nose. In fact, most really good athletes breathe through our nose when we run, when we train, and we only do mouth breath at the end of the session because you'll actually reconfigure the nervous system. It's very powerful. And so the first part is throughout the day, you should be breathing through your nose and it should be breathing as little as possible. But then we have the transformational breathing or the breakthrough type breathing that we did together, Todd, which is very active. And this is where we see a lot of healing. The reason for this is because you're super oxygenating the body. Gary Brecka is a great functional medicine specialist. He's not a doctor, he's a researcher though, and he's been doing this for years. Gary Brecka, you might want to look him up if you're in this space. And he says that all disease is a lack of oxygen. It's really simple. All disease is a lack of oxygen. And honestly, I couldn't agree more. There's a chronic lack of oxygen because there's a chronic lack of movement and a chronic lack of breathing. And again, if you're breathing through the mouth, you're breathing through the upper chest, you're not stimulating the vagus nerve appropriately, and you're staying in fight or flight. Okay, so that's a little bit of science, but also there's one called How Breath Can Control Your Life, which is a systematic review on psychophysiological correlations of slow breathing. What they found was a significant increase in quality of life when you change your breath. And the third one I quote is called Breathwork Interventions for Adults with Clinically Diagnosed Anxiety Disorders. And what they found is there was a notable, significant reduction in anxiety when using breath. And 12 months later, they were still experiencing benefits of breathwork, which, by the way, has zero side effects, unlike most drugs, and is completely free.